Hello, hey, this is Salahuddin Bile. Today I'm presenting the anthrax disease presentation. All right, let's get started. Let me get my laser on. All right, so the first time that the anthrax disease was found or was observed was in the 1700s. The first clinical description of cutaneous anthrax, skin anthrax, were given by Merritt in 1752 and Fournier in 1769. Before this, anthrax had only been described through historical accounts. And anthrax is caused by the bacteria Bacillus anthracis. Um, After that, in 1877, Robert Koch uses anthrax to develop his famous Koch pastillase. He discovered that bacteria form spores and were able to survive a very long periods of time in many different environments. He described how the microbe he injected into the animals caused the disease. From these studies, he was also able to determine the life cycle of anthrax bacteria and was able to demonstrate what became known as the Koch bacillus, which demonstrated a causal relationship between a specific microorganism and a disease. Later, Louis Pasteur creates the first vaccine for anthrax for animals using Cauchy's pastillate work and decided to make a vaccine for the disease. He gave 25 animals two shots of the anthrax vaccine he created with weakened anthrax bacteria. The vaccination worked, and all the 25 animals survived. Then in 19, so that was in 1881. In 1944, penicillin was used to treat anthrax for humans since humans were getting the bacteria from animals. So after that, penicillin wasn't working as much, and vaccine was needed in the 1950s. A vaccine was created for humans, and after that, the bacteria has died, and the infection became less and less popular in the United States. In 2010, however, a new form of anthrax came um, in Europe, and I will talk about that later on. Um, the anthrax is, first of all, I'm going to talk about the physiology and morphology of the anthrax and the bacillus uh, anthracis bacteria. So anthrax is a bacterial disease caused by spore-forming Bacillus anthracis. The bacteria is gram-positive, and the phylum is Firmicutes, class Bacilli, and genus Bacillus. As the name suggests, it is a rod-shaped bacterium. It's 3 to 5 uh, micromilliliters long and 1 to 1.2 milliliters wide. They form long chains when in culture, micrometer wide. So they form long chains when in culture. On agar place, they form large colonies that is white color, and their strains usually produce protein capsule, as you can see here. This is the structure of the bacteria. Here's the white colonies I was talking about earlier. When it comes to reservoir, usually it's mainly grass-eating animals, herbivores, both livestock and wildlife. Anthrax is a zoonotonic disease, meaning that it could be transferred from animals to humans. Um, and also, it can remain in contaminated soil for many years, since this is an endospore bacteria. Um, let's talk about the mechanism of infection. So, uh, in animals and humans, when the spore gain access to either, so there is four ways: either through abbreviation of the skin, ingesting on the infected food, or inhaling the spores, or injecting uh, injection. Spores then germinate into the mature P. Anthracis and starts infection and releasing dead uh, toxins. After that, it starts growing and growing, and after it becomes fully colonized, it destroys the macrophage, and the bacteria colony spreads to the lymph and the circulatory system. And after that, is either like if it's not treated, it can go to blood vessels and can cause blood poisoning and meningitis, or it can cause pulmonary blockage or even death. If not treated, according to the FDA, if not treated, inhale Anthrax early, the fatality rate is 80% or higher. So it is a very dangerous bacteria. Signs and symptoms, as you can see here, this is a skin infection of anthrax. Same for here. So signs and symptoms include like flu-like symptoms. You feel a mild chest discomfort, shortness of breathness, nausea, coughing of blood, painful swallowing, high fever, loss of appetite, and of course, meningitis. Transmission and lab diagnosis. So, as I said before, there's four ways you can basically get the bacteria, either through the gastrointestinal anthrax, which means eating if you eat an undercooked meat from an infected animal, or you inhalation of anthrax, breathing in anthrax spores, which is the most deadly, as I said before, 80% fatality rate, or a cutaneous anthrax, which is skin-related anthrax infection enters your body through your skin, usually through a cut, or this is a new. Uh, I said this in my second slide. It was found in 2010 in Europe. This is through injection anthrax, injecting illegal drugs containing the bacteria. Um, so let me talk about that a little bit. So the new anthrax early was found in 2010. A small outbreak of anthrax occurred in the United Kingdom and Germany. The patient who came to the hospital were using illicit drug uh, and who had used heroin before having the symptoms. Anthrax in this patient did not look like typical cutaneous anthrax. Many had swelling and infection of the deeper layers of the skin, but they didn't have a raised sore with a black center, which is usually the sign used to determine a cutaneous anthrax. So doctors recognized this anthrax as a new type of anthrax, and they decided to call the injection anthrax. For lab diagnosis, there is a couple of ways you can test if you have anthrax disease. So the first way is using a skin testing. Basically, you get a sample fluid from a suspicious lesion on your skin or biopsy, or you can do a blood test, drawing small amounts of blood tests to check the bacteria and grow in a culture. Or you can do a chest X-ray if you think that you have inhaled the bacteria, and so it scans your lungs for the bacteria. Or this is if you ate a uncooked meat and after that you're having hard time you're having abdominal problems. You can get a stool testing and they will check your stool for bacteria. And the last method is for anything except the uh, cutaneous, cutaneous anthrax. Uh, it it requires an inserting a needle into your spinal canal to withdraw spinal fluid to check for linctus, and that's only for non-cutaneous anthrax. So for treatment and prevention, there are multiple ways for you to prevent these. First of all, is getting the vaccine. If you get the three-dose series of anthrax vaccine, um, then you have better chance of not getting the disease. Another way is eating cooked food, um, wearing a mask in contaminated area in countries that have a contaminated air, avoiding injection illegal drugs. As we said before, that in 2010 a new form of anthrax was found. Avoiding contact with livestock, animal products, and animal carcasses. And also vaccinating your animals from anthrax is also another way to prevent the disease. Also, so treatments involve using antibiotics like uh, ciprofloxacin or other antibiotics that use either single or you can use combination of the antibiotics. Or there is a 60-day treatment of the infection, which is also using the antibiotic, but in slow um, and more effective way, which also depends on the method of infection, age, and overall health. For that reason, um, the best way to treat the bacteria is at early stages. If you wait long, if you let's say you have skin disease, you see a black um, a black spot on your skin and you just ignored it for a while, it could cause more problems on a later date. So it's better when you see when you have it either a abdominal problems or hard time breathing, as we talked about the signs and symptoms before. It's better to go to see your doctor at early stages so they can treat the disease and bacteria more effectively. Or there's another way using antitoxins like racetamib and other antitoxins that's available um, to avoid because the bacteria releases toxins and this is overcomes with that. And another way, this is only for cutaneous anthrax, is getting a surgical removal of the infected area. When it comes to immunity, there are processes where the bacteria follows. So the host macrophage recognize active form of Bacillus anthracis using a cell surface receptor called the TLR2 for all hosts, which binds then to a lipoprotein molecules in the bacterial cell wall. Here's a figure action showing what's happening overall. In humans, though, especially, there's two receptors called TLR7 and TLR8 to recognize the RNA molecules in the outermost layer of the anthrax spores. In conclusion, I would say that this distinct recognition mechanism means that anthrax spores provoke a distinct immune response in microwave. And it is this observation that usually um, pharmaceutical companies use to make vaccines of the or made vaccines back in the early days to combat the anthrax disease. Fun facts about the uh, disease or the bacteria. So after years of vaccination and prevention, it is extremely rare to get anthrax in the United States now. Well, outside of biotourism, Anthrax is not contagious from person to person, as we said earlier. It's contagious from animal to person, but not person to person. The bacteria that causes anthrax is Bacillus anthracis, as we said earlier. Anthrax symptoms and severity depends on how you were infected. So inhalation is the most deadliest, and so on. Nowadays, it is easier to test and quickly grow Bacillus anthracis in a culture from an infected tissue. So if you let's say you have a skin that your skin was infected, it is easier for doctors nowadays to quickly test the bacteria and grow it in culture and give you a response within that same day. Anthrax is preventable by taking the FDA approved vaccine in many countries that is still having underdeveloped countries. Okay, here is five questions that I prepare for you to basically summarize. Um, I will give you guys about 30 seconds to look at it. I will read each question. So, what is the bacteria that causes anthrax? Is it Bacillus cereus? Is it Bacillus classy? Is it Bacillus anthracis? Is it Bacillus subtilis? All right. So let's reveal the answer for that. So for this will be C, Bacillus anthracis, as we mentioned earlier. Um, let's move on to the second question. What is the fatality rate of anthrax disease if inhaled? So if you inhale the bacteria, what's the fatality rate in earlier stages, and if the disease is not basically treated? Is it 20 to 25%? Is it 5% or lower? Is it 30 to 40%? Or is it 80% or higher? All right, as you may have guessed, it is 80% or higher. Is D. This is the inhalation of the disease of the bacteria is the most dangerous way. All right, let's move to the third question. What is the best way to avoid getting the anthrax disease in underdeveloped countries where the infection disease is very high? Is it using drugs? Is it eating cooked food? Is it using penicillin? Or is it getting vaccinated for the anthrax disease? All right. The answer is D, getting vaccinated for anthrax. Using penicillin is a good way, but it's not as effective as because the bacteria can resist penicillin. But if you get vaccinated for anthrax, then um, it is very unlikely that you will get sick. Um, let's move to the Fourth question. What is the most dangerous way of getting anthrax disease? This is either gastrointestinal anthrax, inhalation anthrax, cutaneous anthrax, or is it the injection anthrax? All right. The answer is inhaling the anthrax. Is B. As we said many times in this lecture, uh, inhaling anthrax uh, is inhaling the bacteria is the most dangerous way um, of getting the disease. All right, and the last question: when was the first vaccine created for anthrax for animals? So I mentioned this on the basically early um, on my lecture. my second slide showing the history. So is it 1881? Is it 1734? Is it 1856? Is it 2010? All right, as you may have guessed it, is 1881. So this was when Louis Pasteur was first created the first vaccine for the bacteria or for the disease for animals. Um, yeah, and that'll be it. Thank you very much, guys, for listening. Have either a good day or a good night. Thank you.